All right, good morning, everyone. I am here today with our Health Commissioner, Dr. Terraza, to provide updates on our city's COVID-19 response. We know here in Baltimore we've made a valiant stand against COVID-19 through everything the pandemic threw our way. Baltimore, as we always do, stood strong. We did lose far too many who were dear to us, but we know that we will continue to honor them, and that without the efforts that we took, the masking, the social distancing, the vaccination, the other things that we had to do, we would have lost many more. And we're going to continue to honor those that we lost by understanding and treating this pandemic with the severity that it deserves. Thanks to the leadership of Dr. D, our health experts, and our residents, our city has been a national model for how to withstand the impacts of this pandemic. As always, Dr. D and I will continue to follow the science and allow the data to drive our decision making. And as a result of our work to provide appropriate PPE and community testing to our residents, we are seeing a significant decline in our city's COVID-19 metrics. I'll let Dr. D touch on this in more detail, but cases, positivity, hospitalizations are all down to just a fraction of what they were a few weeks ago. And as of February 22nd, just over 76% of residents 5 years or older have received at least one dose of the vaccine. Community transmission is down. And in light of these data points, I want to announce that effective March 1st, Baltimore City will no longer have an indoor mask mandate. We will continue to monitor our COVID-19 metrics and make informed decisions should another variant of concern begin to emerge across our communities. This mask mandate will go away again on March the 1st. The mask mandate for city employees will also be lifted on March the 1st. I want to be very clear. This does not apply to city school students. Our school system has their own mask mandate that has to be lifted in partnership with our partners at the state. I want to thank everyone, our businesses, our faith institutions, and most importantly, Baltimoreans for adhering to our recommendations from our local and national health experts. There is now an even brighter light at the end of the tunnel, and hopefully we can begin to return to our new normal. We are going to continue to focus on this, but make sure that we are adapting to the new world. As always, we'll continue to prioritize the health and safety of our residents. And with that, I will now turn it over to Dr. D. Dr. D?
Good morning, and thank you, Mayor Scott, for your continued leadership during the pandemic. I'll begin by providing some data updates. Because of the Maryland Department of Health data breach in early December, we currently have limited ability to update our public-facing COVID dashboard with case, testing, and vaccination data, but this information is accessible on the Maryland Department of Health or MDH COVID dashboard. This can be found at coronavirus.maryland.gov. MDH's dashboard indicates our COVID positivity as of February 22nd was 2.03%. This represents a 77% decrease from our positivity level of 8.72% just a month prior. The state's dashboard also indicates our 7-day average for COVID new case rates is 18.37 cases per 100,000 people as of February 22nd. This represents a 78% decrease from our new case rate of 81.99 cases per 100,000 people from a month earlier. Between February 18th and February 22nd, however, we did see an increase in case rates from 7.49 cases per 100,000 people to 18.37 cases per 100,000 people. We believe this increase is related to MDH updating its data to include older cases and reinfections. Given this recent addition of prior cases, Baltimore City's CDC COVID transmission level did change from substantial to high. Again, this shift is related to what we believe are reinfection cases being added to the system by MDH. Overall, we are encouraged by the significant decline in case rates and positivity that we've seen in the past several weeks. As of February 22nd, city hospitals were at 86% capacity in the ICU and 89% capacity in the acute care units. As of February 22nd, There were 161 patients with COVID-19 occupying beds in city hospitals. For reference, on January 22nd, there were 696 patients with COVID-19 occupying beds in city hospitals. According to MDH data as of February 22nd, 76.8% of all city residents 5 and up have received a first or single dose of the COVID vaccine, and 67.4% are fully vaccinated. Given these significant improvements in our metrics to date, especially the stark decline in hospitalizations and case rates, and the large percentage of eligible residents who have received a vaccine, Mayor Scott will be lifting the current indoor mask mandate in Baltimore City effective March 1st. I want to be clear, though we are encouraged by this improvement in our COVID-19 metrics, this is in no way an indication that the pandemic is over. Rather, we're entering a new phase. It is also not a sign that the public health protocols and measures that we've put in place to date are no longer necessary. Masks and vaccines remain an important tool in our fight against COVID-19. Testing and appropriate isolation and quarantining also remain fundamental as we continue to work to limit the spread of COVID-19, especially amongst our vulnerable groups, including our older adults, the immunocompromised, and our children that are not yet eligible to be vaccinated. Though masks will not be required after March 1st, I still encourage individuals to wear masks in indoor crowded spaces, especially those that are poorly ventilated, and businesses are still have the right to require masking of patrons on their premises. And by all means, if you haven't gotten your first dose of the vaccine, please get it. Our previous hospitalization data still indicates the majority of those admitted or suffering severe outcomes from COVID are the unvaccinated. If you're due for your second dose, get it. Completion of the series is required to get adequate immunity. Even if you had COVID, get the entire series of vaccines. And lastly, if you're eligible for a booster, get it immediately. We know immunity gain from the initial series decreases over time, and getting that booster helps to strengthen our immune system's ability to fight off COVID. As a reminder, everyone 12 and up is now eligible to receive the booster dose. The Pfizer or Moderna booster can now be taken 5 months after completion of the 2-dose series, and Johnson & Johnson requires a booster 2 months after your initial single dose with either Pfizer or Moderna. Do not delay getting your booster, and get the booster as soon as you're eligible. As I just stated, that booster is necessary for optimal protection against severe disease, hospitalization, and death, even if you've had COVID. As a reminder, our 5 to 11-year-olds are also now eligible to get the 2-dose vaccination series from Pfizer. Those 5 and up who are moderately to severely immunocompromised and vaccinated with Pfizer or Moderna should now get a 3rd dose and a booster. That booster should be taken 3 months after completion of the 3rd dose. Please go to our website to learn where you can get vaccinated at covax.baltimorecity.gov. Again, that's covax.baltimorecity.gov. We recognize testing also remains an important tool for early identification of disease. We've also partnered with Enoch Pratt Free Library to distribute at-home test kits. Close to 60,000 test kits have been distributed through Enoch Pratt Free Library to date. Test kits are available at Enoch Pratt Free Library branches when libraries are open, while supplies are available. Approximate quantities available at each branch can be found at Enoch Pratt's website, www.prattlibrary.org/services/at-home COVID-19 tests. Additionally, the federal government is now providing 4 free test kits per household in the mail. To register for this program, you can go to covidtest.gov or call 1-800-232-0233. The health department continues to test throughout the city. Please go to our website to see weekly testing locations at coronavirus.baltimorecity.gov/testing. In addition to supplement the library distribution of free test kits, the health department has restructured our distribution of test kits to community-based organizations to best meet the needs of city residents. A few weeks ago, we opened an RFP process and will be providing test kits to up to 30 eligible community-based organizations that support our value communities or those that have been most disproportionately impacted by COVID. These CBOs can subsequently distribute up to 50% of their supply of kits to other organizations. We are currently reviewing applications received and plan to announce the selected CBOs in the coming weeks. The Health Department also recently announced our partnership with Civic Works to provide test kits to homebound residents with COVID symptoms who call or text Civic Works at 410-929-5448, Monday through Friday from 9 a.m. to 6 p.m. with your name and contact info. Test kits will be distributed within 24 to 48 hours of the request, excluding Sundays. Each household is eligible for 2 test kits per month. We're making great progress as a city and are encouraged by the improvement in our COVID-19 metrics. However, the pandemic is not over. Residents are still being infected and hospitalized with COVID-19. In particular, older adults, the immunocompromised, and children that are not yet eligible for vaccination remain vulnerable to severe disease from COVID-19. And masks remain a powerful tool to protect these residents. We know what we need to do, and we have the tools to continue to work to decrease COVID-19 transmission in our community. If you test positive, stay home and self-isolate and manage mild symptoms at home. If you haven't already, please get vaccinated and boosted. If you are already vaccinated and boosted, strongly encourage your friends and family to do the same. This simple act may save a life. Thank you.
Thank you, Dr. D, and I want to recognize you and the entire Health Department for being the guiding hand that has hopefully, knock on wood, gotten us through the worst of the pandemic, and for your work and your team's work each and every day. Now we'll open it up for a few questions. Alexa, Mackenzie?
Hello.
I think you're good. You're good.
Would you discuss the steps that need to happen to reopen City Hall? Have you all had that conversation, and could you give us the details of that conversation?
So I've discussed this with Dr. D and the team internal. The next step before we talk about that publicly is me talking with both the council president and the comptroller, as they play a role too and want to allow them to get that information directly from me. But you should expect to hear from me and them, hopefully together. I'm going to ask them to be a part of this within the next few weeks.
In terms of the science, though, what would need to happen?
Again, I just gave you the answer. It's not going to change.
So no set date?
Mackenzie?
Mine are off topic, so I can wait.
No, you might as well go. I mean, I don't think anybody expected you to have an on-topic one.
Go ahead.
Thank you. Just wanted to follow up, Mr. Mayor, regarding city schools. You mentioned that, I'm sure you've been in conversation with them, but you're saying it's their decision?
Yes, it is their decision. It's Dr. S's and the board's decision. I know that Dr. D, as she has throughout the pandemic, will be giving them the public health advice, and they will make the decision with that information, thinking about how to keep the public health of our teachers, our students, our staff, and those families as safe as possible.
Are you hopeful that it will happen? I mean, you just answered it, but are you hopeful that this will certainly, with all the other districts around us doing this?
Yeah, we'll see what the decision is. We know that it's happening around. The most important thing now that is, you heard from Dr. D, it's safe to do so now, and we'll see how it goes from there.
Thank you, Mr. Mayor.
Emily?
The status of the testing policy for city employees and the vaccination requirement, given that you're lifting the masking requirement?
Yep, Emily, we will be actually sending out, and we'll send to you through the administrator how we're going to be adapting and changing those policies in a formal way. This decision that we made late yesterday really is about now we're going to be able to readjust all that, and we'll be sure to share that information with you.
But you are thinking it may change the policy in some way?
Yes, we are thinking it may change.
Okay. And the indoor masking, does that apply also to City Hall when visitors are in there?
Yes, it's for City Hall, it's everywhere.
Okay.
Though you'll probably still see me on with one. Mackenzie?
All right. Given what we know yesterday about the 16-year-old who turned himself in connection to the murder of Cheryl McCormick, he was a student in Baltimore City Public Schools. We're learning that since June of 2021, 9 handguns have been recovered from inside Baltimore City Public Schools. Do those data points concern you at all about the safety of students inside the school district?
I think for me, I'm concerned about, Mackenzie, the safety of our young people inside, outside of school, when they're in the city, when out of city, no matter where they are in the world. We know that we have to continue to press upon our partners with the school system and others. We know the school police does a great job. I think what we have to do is make sure that we are all working to keep our young people safe. But when you think about, and you and I talked about this a little bit in Annapolis yesterday, I think this is another example, and I'll be back in Annapolis today talking about what has to happen after BPD does their job, after an arrest is made, right? Because we are seeing, whether it's young people or adults, the same people over and over, right? We are seeing that, and we have to have these changes with these state systems to make sure the impact is happening there, that people are being monitored properly, that they're actually being rehabilitated when they're in prison and not just sitting there, that we're offering services, connecting dots, closing loopholes like we talked about yesterday, so that we're not seeing the same revolving door, and that our communities are starting to see some peace.
A couple of things with that, though. So if you say that the police are doing their jobs, is the onus on the prosecutor's office for not?
No, I think that for me, you hear, I'm going to say this again. This is not a one-person issue, right? When you talk about the fact that it's about everybody. This is why I restarted the Criminal Justice Coordinating Council, to end the finger pointing, to end the saying it's one office, because everybody involved in the system has to be better. Everybody, right? That includes, I always start with us. We have to be better as a police department. We're going to continue to do that each and every day. But when you think about what you heard in Annapolis yesterday, where Baltimore, the city that has the lion's share of the violence issues in our state, is the only state where the local police department is not notified when people are released. We have to think about those issues. When you see consistently we're dealing with issues of people who are supposed to be under state supervision with an ankle bracelet on, committing or being a victim of a crime, that means that system has to be looked at. When you see what happens in our court cases, everybody that is involved in cases in court, we have to look at changing those systems. This is not about one person. This is about fixing a system that has been broken, Mackenzie, longer than you and I have been alive.
Quickly, when you looking at the school, we often talk about crime and education being linked. That's a conversation that we've had multiple times. At this point, do you still have confidence in the superintendent, Dr. Santelises, to execute and help students get the education that they need while under her supervision?
Yes, I do, unequivocally. And I think that we have to understand the great things. And I would challenge your station in particular, as you guys are the sponsor for College Bound, to showcase more of that. The thousands of our young people who you guys help to send off to college each and every year, who come back, who are now doctors and lawyers, folks like myself who went through that program. And we have to not just, Mackenzie, highlight the very small amount of young people who get involved in the wrong thing, right? We have to talk about that, because we have to be better for them, hold them accountable, hold their families accountable. But we also have to highlight the thousands of students from Baltimore who do great things every day, like the young people at Billie Holiday Elementary that I'm just coming from early this morning.
But we know thousands of students are failing.
Mackenzie, I think that we understand again, and I know this is something you and I have talked about before, and this is the last response you're going to get. When this state, the wealthiest state in the wealthiest country in the history of the world, willingly underfunded a school system by $300 million for decades, and we had to again fight this week, thankful to the Senate for doing that, to get fully funded. You cannot expect to have platinum results when you're putting in wood. Thank you.